Hello, my name is ABIENVENU, and today we're going to talk about blood administration. We're going to talk about this procedure of blood products and the patient identifications. This video is very complex because the severity and the acuity of blood transfusions for patients. First, you want to make sure that you gather all of your equipment prior. You don't want to be going back and forth in between the patient's room, making back to the blood bank, back to the Walmart room. Make sure that you have all your supplies in the room in an emergency situation like this. I'm going to do a little background on blood administration and blood products before getting straight into what I would do to the patient. So, if the patient, like I said, maintain all the equipment needed. Um, Now make sure that the patient only has normal saline running. If that is the only one of the only ones that are compatible. A lot of them are not compatible with blood. Just make sure you flush the lines. If the patient has something running outside of normal saline, flush the lines, change the lines. Preferably change the line, flush the patient's IV. Make sure the IV is at least an 18 gauge because anything bigger, say the patient has 20 or 20, any size bigger than that, you take the risk at busting the clots, or busting the cells, and which defeats the purpose. So you also, in your equipment, you need to have a blood set, your infusion sets, say filters, anything depending on whether it be a blood transfusion, a blood component, medication, anything related to blood. You have to have the infusion sets. Um, Also, just gonna touch on this. There is blood warmers. Sometimes that's usually used for surgery. Surgery has the blood warmers, and now a little background on that. We're going to transition into the patient's preparation. Uh, you always have to have an informed consent. Um, Usually, admissions would ask the patient, "Do you have any religious beliefs, or do you, if such medical emergency arose that you have to have a blood transfusion or a blood component, do you agree with that, or do you want that?" And the patient has the right to deny it. And as a healthcare professional, at times that can be hard, but at the end of the day, we have to respect the patient's wishes. So the informed consent must be signed. Um, you need to educate them on the possible risk, the benefits, the alternative treatments, and the possible consequences of not receiving the transfusion, whether it be death or just you want to. It'll make the patient a lot easier because it has such a bad stigma. You hear blood transfusion, oh my goodness, something's really severe. Well, the patient may not think that they're at that point yet, but they are. So education is a really big factor into this scenario, or just anytime you're dealing with blood administration. So if the patient has a religious factor that doesn't allow them to have blood transfusions, one, Jehovah Witness. Jehovah Witness doesn't believe that they should receive the man of another, blood of another man, and that it's not pure. That's their wishes. That's their belief. So as a healthcare professional, you have to respect that. You can educate them, but odds are most of the time they're not going to do it because they're dying. They would rather choose to die than to go against their faith. So it's going to be hard, and I know that once I am going to be exposed to that, it's going to be really hard for me to be able to grasp that. But I pray that when I come to that situation, that I'm ready for it. You want to make sure that you check your physician's orders. Make sure that you have the right product, you have the right volume, and the infusion rates. You want to make sure that you have a crossing type on your patient, because you have to identify what type of blood the patient has. You can't give if you give a patient A and they have B and it's not compatible, so you have to make sure address that initially ahead of time before you go in any further. So you definitely have that. You want to, when you get that, you have to go to the blood bank. But prior to getting the blood bank, you want to print out a sheet. A sheet that says with the patient's like name. We have the name, the CPI number. You want to have the form, and so when you go there, you contact the blood bank. You say, or actually it sends it over electronically. And so when they receive it, they have Miss Betty Joe. She's type A positive or O or whatever she is. And you go, she has an identification number. So when the blood bank calls it, hey, such and such is ready. Most hospitals, you can walk down to the blood bank or they bring it to you, or a tube system. Whatever the policy is per your, or whatever protocol there is in your facility, make sure, obviously, go by that. But we're going to talk in a hospital where you physically have to walk to the blood bank. So the blood bank calls and says, okay, such and such is ready. So as a nurse, I walk down, I check, I go to the blood bank. In my hands, I have the patient's blood form. The blood form, and I go in, I need to get Miss such and such's blood. Okay, they go to the back, they come forward with the blood in their hands, and at that moment there's a check. It needs to take place. The nurse is saying, I'm requesting the blood for Betty Joe, her number is this, the blood type is this, all the identification numbers on there needs to be read back and forth. I say it, and the blood bank employee says it back to me. It's 2 checks right then and there before we even get to the patient's room. And it needs to be an initial check to make sure this is the right patient, that she needs a blood transfusion or blood product. When you get to the blood bank, there's another check. After having the blood in your hands, you need to not allow that blood or blood product to sit out longer than 30 minutes. Or hang it before 30 minutes. Once it's hung, it can last up to 4 hours. Okay, but the key is you cannot, if it's not refrigerated within 30 minutes, it's no longer any good. So if the physician says, I need 3, just say 3 or 4, say 3 packs of red blood cells, well, you can let the blood bank know this, but take 1, or say take 1, and instead of getting all 4, it's going to go to waste. Blood is very rare. At certain times, if it's a certain type of blood, you want to make sure that the patient doesn't. As a healthcare professional, you don't waste it. It's very valuable and it's very just critical for life. So, you want to just make sure your safety checks have been met throughout this whole step. And okay, so prior to the actual blood transfusion, now you're in the room, your patient knows they're about to have a blood transfusion, they know all the risks, they know everything, they did the informed consent, they know the alternate treatments, they know everything, they absolutely have to have the transfusion. Okay, again, we want to verify our physician's orders, and now at this step here, you're going to have two nurses, a physician and a nurse. It has to be 2, in my situation, I'm going to say 2 RNs. Okay, you, at the bedside, you want to do your proper verifications of this patient, whether it's reading on the armband, or you read off the armband and you say the patient's name, you say the patient's code, the number, you do the patient's blood type, and then the other nurse is going to read off the bag. It's gonna be hooked to it. There's gonna be a paper that's clipped to the bag of the blood transfusion, the red the red packed red blood cells. On that sheet, you got to make sure that it says Betty Joe, the correct number, and the blood type. You never want to, if it doesn't say that, then you need to contact the blood bank immediately, because you never give the wrong blood to the patient. Because it's not okay. Blood isn't universal, except, but at the fees of purpose, if it's not correct, then someone needs to be aware of that. It needs to be documented. So if everything is fine, you definitely want to get your vital signs before. So we need to document the all your vitals, making sure that there is no fever, making sure that the blood pressure was within range, the respirations, and the pulse. So just a very just overall assessment on the vitals, because that's going to be our baseline. Once we start infusing the medication, you're going to have to do a 15-minute check and a 30-minute check. It has to be you. You're the nurse. You have to stay in there with your patient throughout that time. And you compare your baseline before we started to compare throughout the process. Now, if there is, say, a fever, or if you start to see different, it's gonna be the next video. Sorry about that. Just anytime you see, if there is a reaction, I'll just say this: if there's a reaction, immediately stop the transfusion. If it's a anaphylactic reaction, you definitely stop it. The thing with this blood administration is key is making sure that you're in there, the correct patient, the correct type of blood. All the verifications have been met, and make sure that the blood is for that patient, and that you have the right blood, because just if it's not compatible, then it defeats the whole purpose, and it starts a whole nother just complications on top of that. You want to do a 15, 30 minutes, and then an hourly check after the transfusion. If I will say this as well, it's going to reiterate in another video, but if there is a pre-existing fever, we need to see if this is an emergency situation. And so it outweighs the risk of the fever. The problem we run into this fever is if it has a fever initially, and then we give the transfusion, you don't know if that fever is secondary to the transfusion. You don't know if it's linked to that. So it's in a sense it's masking it. So just make sure that you cover all your grounds with the checks. 2 nurses in the room reading back and forth each other, the patient's name, identification, the type of blood, as well as in the blood bank. Make sure you have a consent. Make sure that you do vitals. And I believe that is all to medications with blood products, as well as blood transfusions. I thank you for watching, and I will see you on the next video.